My name is Dr. Hariom Sharma, MBBS, MS, ENT specialist, and skull waste surgeon. Myself, Director of Rameshwaram Super Specialty Hospital, Gwalior. Today, I am going to discussing on esophageal disorder, mainly Barrett's esophagus. First, we come on what is esophagus. Esophagus is the muscular tube that connect mouth to the stomach. And what is Barrett's esophagus? Barrett's esophagus is the condition in which normal mucosa that is lined the esophagus is replaced by the intestinal mucosa is known as the Barrett's esophagus. It is also known as the intestinal metaplasia because this is replaced by intestinal mucosa. Who is the common people who suffered from the Barrett's esophagus? The patients mainly suffered from the Barrett's esophagus are the that having acid reflux for a long time, or those suffered from the condition known as the gastroesophageal reflux disease. Here is the main condition of developing gastroesophageal reflux disease. These are developing countries have a higher chances of the cancers in this disease. The disease on its does not have any specific symptoms, as this is caused by sometimes irritating the walls of your food pipe for a long time. The symptoms will be of that specific condition. It is commonly seen in the patients of gastroesophageal reflux disease. These symptoms mainly, that is heartburn, find difficult to swallow food, and sometimes also feel chest pain. The conditions usually detected by taking a look at the esophagus using a flexible endoscopy and a camera at the end, collecting a small sample or biopsy and look at that microscope. When we in microscopy, when we see the intestinal lining in the esophagus, then we confirm it is the Barrett's esophagus. There are many ways of managing the conditions, including the use of medicines which prevents the production of the stomach acids. So following some proper diet plan, how we plan the diet plan, smaller meals instead of the heavy meals, and this help lessen the chances of the Barrett's esophagus and prevents the gastroesophageal reflux disease. Also, we would like to avoid such as eating acidic food like citrus fruits, lemon, orange, and tomatoes, and limit of completely avoid alcohols, and also avoid smoke, avoid eating chocolates or having coffee or having higher caffeine contents are related drink. Do not consume fried, high fat or spicy food. Avoid stress, main cause of the acid producing, and eat more meals in smaller portion instead of the larger meals throughout the day, and wait for a few hours after eating and before lying down. If you have been suffering from acid reflux or heartburn for a long time, you should discuss with your doctor about the possibility of developing Barrett's esophagus. Now, in nutshell, I will suggest how to prevent the Barrett's esophagus. If we want to prevent the Barrett's esophagus, first we prevent the acid production in our body and also prevent the gastroesophageal reflux disease. So, how to prevent the gastroesophageal reflux disease? By proton pump inhibitors, by taking a proton pump inhibitors, or to slope your bed, higher your head position about 30 degree to the normal position, then there is a decrease in the acid reflux and gastroesophageal reflux disease. And how to prevent the acid? To prevent the taking acidic food such as citrus fruit, such as citrus fruit like lemon, orange, and some containing higher caffeine, tea, stress. These prevent the acid production as much as possible. And main important thing, how to prevent the acid formation in our body and its effect on our esophagus by taking a smaller foods, smaller food in frequency instead of larger foods in once or twice a day. We take about 5 to 6 times a day, so that we prevent this disease. Otherwise, it may change into the cancerous condition and may danger our life. Thank you.